everyone, and welcome to Lipedema Wellness Conversations with Gail. That would be me, and friends. And our friend today is Sharon Tillery. I know that in our invitation, it said Carrie Reedy was going to be here, and majority of you know who Carrie Reedy is, which is exciting that you know her. But today, was it today? No, it wasn't. It was yesterday. Today's Tuesday. Yesterday at a coaches meeting, um, Sharon joined us for the very first time at our coaches meeting. And Carrie said, "Oh, Sharon can have my spot with you tomorrow night, Gail." And so we are extraordinarily excited to introduce our new coach with Lipedema Simplified, Sharon Tillery. She is a life, spiritual, health, and wellness coach, and she has just joined us this last month. So make sure you get a chance to say hi to her in the comments. Let us know where you are coming from. If you want to give a weather report at the same time, we don't have a problem with that. If you want to ask a question. Just feel free to open a conversation. And we are just absolutely 100% excited to
Yeah.
introduce our newest coach, Sharon Tillery. Hi, Sharon.
Hi, everybody. Hi, Gail. Thank you so much for the invite. I am excited to be here.
We're happy to have you. I just want to let you know Kathy Patton's here today from Union, New Jersey. Our very own Jeannie Lewis is here from Colorado. Uh, Catherine Sayo, who we all love and know, says, "Sharon, so glad you've joined us." This comes from our very own Catherine.
Hi, Kathy.
Um, Darlene's here from Singleton, California. Anne is here. She says, "Good luck
You.
um, with your new job." Patty Taylor's, it says Pat Taylor from Port Richey, Florida. And Diane's here from Portland. And we have about 16 people on right now. Um, and I know that, people come, they trickle in. So we'll have a few more than that. So Sharon, I have to say welcome. So glad you're here. But I'm I'm new to all this health, wellness, life, spiritual coach thing. I don't know very much about it. So hopefully today you can share with me some of what you do, some of what how you got started. But the first thing I want to know is how did you how did you decide or start working with the lipedema community?
Oh, well, by profession, I am a medical assistant. So I work in the medical field and I was looking for something new. I love doing new things. So I wanted to do surgery, like work in the ER. And certain places don't let you do that. But this one doctor, he needed a medical assistant. He was just his office and he needed, medical assistant to kind of run it. And so I applied for it. He hired me, and that was like my dream job, honestly. And that's all he did was lipedema patients. He did veins, and it was like a med spa, but he really catered to the lipedema ladies. That's what we call them, the lipedema community. And I would always prep the women for surgeries before, after, hold their hands during the surgery, talk to them. We sang sometimes. We just, made the surgery because they were awake the entire time. So him, it was like liposuction, sucking out, the fat, the unwanted fat, and making sure they were comfortable, making sure we had just like music playing and feeding them lunch and doing all the beautiful things that made them happy during their surgery. So this doctor, he was like the open door to me understanding what lipedema was about and how it affects so many women and how other professional doctors don't look at it for what it is and how just awful that was. So he just made them feel like the special women that they were, and we just had a good time with them in the office, just like taking care of them. And that's how I kind of found that lipedema community, just through working as a medical assistant with Dr. Shapiro. Yo, you still there?
I choose. There we go. And we're back. We know that these things are happening right now,
Yeah,
especially on the East Coast. It seems like a lot of people
yeah,
have been having problems with the internet. I think it's all the
yeah,
storms coming through.
yeah.
So, Julie Morris is here. Hi, Julie. Or Julie Morris. Julie Stewart's here, and Darlene's here also. So I'm really glad. So, so when you are you still working for Dr. Shapiro?
No, I no longer work for Dr. Shapiro. I actually work in a hospital like 2 days a week, still as a medical assistant, but I do my life coaching in the evening, as well as I work 2 days, and then the rest of the week is all coaching.
Okay, and so
Yeah.
you are actually working as a life coach now, as your main profession.
Yes, so I work as a life coach, and I also do a trauma coach as well. So I
Okay,
have a lot of coaching out there under my belt.
okay. So Diane wants to know if you can say any more about vein surgery. How do we know if we need it? And that's a question because she knows you've been there. And she's like, um, how how do we know if we need vein surgery? And me personally, I went to a vein specialist.
Okay, so yeah, so he did specialize in veins, and what he would do he would measure the veins. He would do ultrasounds with the veins, like varicose veins, to see were they too big. So before he did the liposuction surgery, he would measure the veins and see, and do ultrasounds on to see the depth of them and how deep they were, how wide, and if they were removable, like if he was able to remove them safely and still do the liposuction for the patient. So that would have to come from an examination with the provider, that whatever lipedema specialist that you're seeing, to determine if you need, that vein removed, so it won't affect the actual, liposuction, if you were to get that done, as a resource of getting rid of that unwanted fat.
Right, right. Well, and I remember when I had my veins done, I had my greater saphenous veins laser ablated, and I remember that I went in to have my veins looked at I was um, because I was in so much pain in my calves, and I I had to. I didn't even know about lipedema at that time, and I went to I would have to say it was a spa. It wasn't necessarily like a vein surgeon, but it was
Mhm.
someone who worked with veins, um, as well as other beauty things like
Yeah,
mole
yeah,
removal
like
and
an esthetician or.
right, right, and
Mhm.
I guess they're called estheticians.
Mhm.
Yeah, yeah.
Mhm. Yeah.
So that was one of the things that I had to do. So we're going to move on from that question, and we're going to ask you now where you are, and you are in life coaching, which is not a medical, not necessarily the medical field. It's a more holistic, spiritual, um, in self, I guess, healing of
Mhm.
of the self, and of the spiritual, and of the soul. So tell me, what is it that you do? What is a life coach?
So, a life coach, not like therapists to tell you what to do, not like psychologists to try to, pick your brain for all the, things that went bad in life. A life coach just collaborates with you as the individual to understand what's going on, how do we want to fix it, what is it that you're concerned about and your desired outcomes of what it is that you're seeking. So we just work together. A life coach works together with the client to see what it is that they want, and then whatever it is that they want, we do like experimental exercises for like maybe 7 days to see if that works for you. We'll do like make a plan, we'll do goals, and I'm the one to kind of cheer you on, push you a little bit, make sure that you're getting what you want and you're following the plan that you made.
Okay, so what if I don't know what I want?
And so there's deep conversations. Of course, nothing is just straight off the back. Okay. Everybody is different. Some people really knows what they want. And some people it takes time. So we'll just keep having conversations, and I'll ask you some skilled questions to say to you, like to make you think, to make you like go deeper within yourself and figure out like, yeah, what is it that I want? And then we'll go deeper. Like, why do I want that? Like, how would that help me? Like, what is the outcome that I'm looking for? And how am I going to get there? So it's just, again, some deep conversations with you to help you figure that out. And that takes as much time as you need to take. It's no rush.
Okay, so I like to think of so many of us, um, women of, I want to say, of age. I don't know. We're of age. We're both, we're circling 60, which
Mhm.
is crazy, right? Um, and we've spent our entire lives taking care of our spouses, or significant others, and then we've taken care of our children, and now we're both, you and I are both taking care of grandchildren,
Mhm.
and it feels like we've lost ourselves. I shouldn't say you. I feel like sometimes I've lost myself. Like I don't even know who I am anymore. Where I don't just identify. I remember when I first started working for Lipedema Simplified, how I introduced myself. I am, a grandmother of four, a mother of three, and a spouse of one. That's all I am, right? It was like I didn't even know who I am. So when you work as a life coach, do you help women determine who they are and where they're going? Do you do any of that?
Yeah, if that's what they're looking for. A lot of people, that's not, it'll come along eventually, but that's not the main thing. But if that was your main thing, absolutely we would have a discussion. I love to talk about me time. Me time is something especially for you. It doesn't involve anybody. What do you like to do in that me time? What is it that makes you happy? Do you like to sew? Do you like to paint? Do you like to crochet? Do you read a book? Just sit quietly, listen to music, whatever it is that you like. During that me time, that's exactly what you do with no interruptions. I teach how to set boundaries so nobody infiltrates that time. That time is yours and yours alone. And whatever it is that you want to do, you journal. Okay, you write things down and make things plain to yourself, so that whatever it is that you want to experience, you'll see yourself come alive in your journaling and all the things that you like to do. When you start doing those things during your me time, you'll see yourself come alive, and you'll see what it is that you want or who you really are as
Right.
Gail or anyone else.
Yeah. And so, um, why did you want to work with the lipedema community? Because you're the one from the story I've heard, you're the one who said, "Hey, Catherine,
Yeah,
I
I
want to
stalked,
talk to you about this."
I stalked her for a little while. Because again, when I worked with the lipedema ladies, for the 2 years that I worked with them, and I really didn't want to leave, but I had to leave. But I wanted to, like, what can I do? Like, I can't go back to that particular setting, but I want to do something because they deserve it. I think lipedema women or ladies are so resilient, and they are such an awesome group of women, and I just wanted to get back in there and make sure that the care that I gave as a medical assistant, I can give it, but I can give it on a different level as a life coach, a spiritual and health and wellness coach. So that's how I'm getting back into it that way. And thank God Catherine was like, okay, come on, you can come over here with us.
Yeah, yeah. Catherine has been really excited. I'm going to share one of the comments that's in here. It's from Diane. It says, "I am stage 3 and probably won't do more liposuction because I'm too old. But my legs are getting more painful, so thank you, Gal. Sounds like vein surgery might help with some pain. And I will follow up. I am a life coach therapist myself, so fun to listen to talk. I currently work with children and families. Good to have a life coach for lipedema. It's a terrible disease. So, with that, do you work with just one on ones? Do you work with families um, or communities? What is it exact? Who is your target demographic? Who's your demographic?
Well, right now I am doing a lot of one-on-ones. I have done families, I have done teenagers, not in the lipedema realm, just as a life coach, and a health and wellness coach. As you see, I just started with you, but having the background and some knowledge, I really feel like I could just really be that support, another part, not just that support, another part of the support system that the lipedema ladies, deserve. So yeah, I have done, group, personal, but right now my main thing is one-on-ones, but I'm loving to dive into the groups with what's uh
Carrie?
Carrie. Yes, Carrie. Yes, yes. It sounds so interesting last night when we were talking about it. So yeah, I'm looking forward to that.
Yeah. And we're looking forward to you working with us. I want to let the community know that tomorrow, if you would like to hear more from Sharon, tomorrow we are having a free webinar. I'm going to put it across the bottom. You're invited to join us. It's at 6 p.m. Eastern tomorrow. It's a free webinar. I am going to put in the comments. I am going to put the link where you can register for that webinar if you're not registered already. And so if you just go into the comments where you see the link, you can just click on that link and sign right up. It is free. Catherine, Sharon, and I will be there. And then I also, if you are one of those people who would prefer to use to copy something down. I know that sounds crazy to me. Instead of clicking on a link, this is your what do they call it, a URL or whatever. I don't know what it's called. I'm not a techie person. Anyways, just put learn LEARN dot lipedema hyphen simplified.org slash free hyphen webinar, and that will take you to the registration link. So make sure that you come see us for that tomorrow. Um, and I'm going to be at that webinar. I'll be talking about community. Catherine's going to be talking about, of course, what is lipedema and how do we get, what are the next steps? And Sharon, what will you be talking about?
I'll be talking about managing your emotional, psychological, mental, and spiritual, how you manage all that and why that's important.
Right, right. That's wonderful. And this is a free webinar to get you thinking about who you are, and 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 it's leading us. Um, I've also got to tell you, in the month of August, we are going to hold what we call a CSIG, and it's called "There's More to You Than Meets the Eye," and we really believe that Sharon is the epitome of "There's more to you than meets the eye," right? I mean, we're busy looking at, like, we might look at our legs, we might look at our physical stature, but there's so much more to us than that. And a life coach, a spiritual wellness life coach, can really help you find who you are, where you want to go, and how to live your best life with lipedema. Let's see, I've got a comment here. Oh, Kathy's registered. Yay, Kathy. We'll see you there tomorrow then. Um,
Yay, Kathy.
and let me go back to here because I want to um, make sure that you have Sharon's name. So if you want to reach out and get a hold of Sharon before tomorrow, because you'll see her tomorrow too at the webinar. But if at any time you want to reach out to Sharon, just make sure that you email either me or Catherine. Sharon is so brand new that we don't have Sharon's email address yet created. It's coming. Um, and so if you do want to reach out to her, just make sure that you either reach out to me or to Catherine. And you can always find that at you can always find let me find me. This is always crazy. Yeah, just throw me a note. I know it says mailbag. I'm the mailbag. Gail at lymphedema-simplified.org. You can always reach out to me and just let me know that you want to talk to Sharon. I can get you set up to talk to Sharon. Before we go, Sharon, I would like to ask you what I ask all of my guests. If there was one message that you would like echoed around the world for everyone, what would that message be?
Well, right now, for me, as I was telling you before, like I've been on a spiritual hiatus for myself for the last few months, and just being with myself the most and understanding my makeup and who I am. And being a little introvert, you might not be able to tell that, but but just understanding, like, my message was not to take it personal. Like, don't take anything personally, because when I do that and I take things personal, everything looks dim, everything looks grim. It doesn't look bright. It doesn't look like there is life to it until I take the personal out. And then I can see the beauty of all things, even when things doesn't even look like they're going well. But I can pick the beauty in it. I can pick the beautiful things out of it, and hold on to that. So I would say that to the world, like, don't take it personal, no matter what it is, no matter who it is, no matter what the situation is. Just find the beauty in it and hold on to that.
Yeah, that's not always very easy.
It's
But
not.
man, it's something to aspire to be able to put the personal aside, just
Yeah.
let that and find the small beautiful sparkles that are in there.
Yeah.
Um, and with that, Sharon, I want to thank you so much for being my guest tonight. I am thrilled, absolutely thrilled that you're going to be working with our community, and I know that they too are going to just benefit from your presence with us. Thank you so much.
Thank you, Gail. You're welcome. And thank you again for having me and inviting me and letting me into this beautiful space that you have for such an awesome set of women.
Yeah, thank you. Well, we'll talk to you soon.
Okay.